Where is your pancreas? What does it actually do? Can a damaged pancreas heal itself? Most people cannot answer these questions until it is too late. Almost 50% of the population suffers from digestive problems like gas, bloating, heartburn, abdominal pain, diarrhea, or constipation. These are all warning signs of diminished pancreatic function. Peter Melamed, Ph.D., a medical doctor trained in Russia who combined Western medicine with traditional Russian folk medicine and Oriental therapies for over 40 years. Along with his son Felix, Melamed reveals something shocking. The pancreas is the most overlooked vital organ in the human body. Their 500-page book, Healthy Pancreas, Healthy You, Part 1, backed by 300 scientific references, exposes 3 modern pandemics silently destroying pancreatic health, leading to a cascade of diseases that conventional medicine treats as separate conditions. This is not just about digestion. This is about understanding the central command center that controls your metabolism, immunity, and longevity. The mysterious organ hidden in plain sight. Your pancreas sits deep in your abdomen, behind your stomach, nestled against your spine. This small gland, measuring only 6 inches long and weighing about 3 ounces, performs functions so critical that without it, you would die within days. Yet most people know more about their heart, liver, or kidneys than they do about their pancreas. The pancreas is actually 2 organs in one. The exocrine pancreas produces digestive enzymes that break down proteins, fats, and carbohydrates in your food. Without these enzymes, nutrients cannot be absorbed no matter how healthy your diet. The endocrine pancreas produces hormones, including insulin and glucagon, that regulate blood sugar levels. When the pancreas fails, both digestion and metabolism collapse simultaneously. Peter Melamed emphasizes that the pancreas only becomes a topic of conversation when it is already too late. When pancreatitis strikes, when diabetes develops, or when pancreatic cancer is diagnosed. By that point, massive irreversible damage has already occurred. A woman named Margaret suffered from bloating, gas, and abdominal discomfort for 15 years. Multiple doctors told her it was irritable bowel syndrome and prescribed medications that provided temporary relief but never solved the problem. She accepted her symptoms as normal aging. Then she developed diabetes at age 58. Her doctor focused on managing blood sugar with medication, but never connected her long-standing digestive issues to pancreatic dysfunction. When Margaret finally learned about pancreatic health, she realized her IBS symptoms had been early warning signs of declining pancreatic enzyme production. Her diabetes was the endocrine pancreas failing after years of metabolic stress. 2 separate conditions doctors treated independently were actually 2 faces of the same underlying pancreatic deterioration. The 3 pandemics destroying the pancreas. Melamed identifies 3 interconnected modern pandemics that create a vicious cycle of pancreatic damage. First is the pandemic of digestive disorders affecting half the global population. Gas, bloating, heartburn, acid reflux, stomach pain, diarrhea, constipation, and food sensitivities have become so common that people accept them as normal. They are not normal. They are symptoms of weakened pancreatic enzyme production and poor bile quality. Second is the epidemic of intestinal dysbiosis, which includes candida, yeast, overgrowth, and small intestinal bacterial overgrowth. When harmful microorganisms dominate the gut, they produce toxins that damage the pancreas while simultaneously impairing digestion. Third is the rising tide of metabolic acidosis, or whole-body acidity. The modern diet, stress, environmental toxins, and inflammation all shift the body toward an acidic state. The pancreas and liver are alkaline glands that cannot function properly in an acidic environment. Acidity kills the pancreas. Dr. Russell Jaffe, a clinician and researcher who has studied acid-alkaline balance for decades, explains that chronic low-grade metabolic acidosis is epidemic in modern populations. His research shows that when body pH drops below optimal levels, cellular function deteriorates across all organ systems. The pancreas is particularly vulnerable because enzyme production requires an alkaline environment. Pancreatic enzymes are released into the duodenum, the first section of the small intestine, where they require alkaline conditions to activate and function. When the body is acidic, these enzymes cannot work effectively. Undigested food ferments in the intestines, feeding harmful bacteria and yeast. This creates more acidity and inflammation, further damaging the pancreas. A man named Robert ate what he considered a healthy diet: lean chicken, brown rice, vegetables, and fruit. Yet he struggled with constant bloating and fatigue. Testing revealed his body was highly acidic despite his diet choices. The stress from his demanding job, lack of sleep, and even his exercise routine were all contributing to metabolic acidosis. His pancreatic function had declined to the point where he was not absorbing nutrients from his food. He was eating healthy but starving at the cellular level because his pancreas could not produce adequate enzymes in an acidic internal environment. The 3 stages of pancreatic function decline. One of the most important insights Melamed provides is understanding that pancreatic dysfunction occurs in 3 distinct stages, each with different implications for treatment and reversibility. The functional stage is completely reversible. At this point, the pancreas structure is still intact. But enzyme production has decreased due to metabolic disturbances, nutritional deficiencies, stress, or temporary inflammation. Symptoms include occasional digestive discomfort, bloating after meals, food sensitivities that develop suddenly, and subtle changes in stool consistency. Most people ignore these early warning signs or treat them with over-the-counter remedies that mask symptoms without addressing causes. With proper intervention at this stage, full pancreatic function can be restored. The structural stage is partially reversible. Here, actual physical changes have occurred in pancreatic tissue. Chronic inflammation has caused some scarring and fibrosis. Enzyme-producing cells have been damaged but not completely destroyed. Symptoms become more persistent and severe. Chronic digestive problems that no longer respond well to medication. Weight loss, despite eating normally, or unexplained weight gain with difficulty losing fat. Vitamin and mineral deficiencies, even with supplementation, and visible changes in stool appearance, including pale, greasy, or foul-smelling bowel movements. At this stage, significant improvement is possible, but complete restoration of original function may not occur. The final stage involves irreversible pancreatic destruction. Extensive scarring, atrophy of enzyme-producing tissue, and possible calcification characterize this stage. This is chronic pancreatitis, or advanced pancreatic insufficiency. Patients require lifelong pancreatic ceto. Patients require lifelong pancreatic enzyme replacement therapy and face greatly increased risk of pancreatic cancer and diabetes. Dr. Suresh Chari from the Mayo Clinic, a leading expert in pancreatic diseases, has documented how slowly progressive pancreatic damage often goes undetected for years before symptoms become severe enough to prompt medical investigation. His research shows that by the time chronic pancreatitis is diagnosed through imaging studies, patients have typically lost 80 to 90% of their pancreatic function. The tragedy is that intervention during the functional or early structural stages could have prevented this progression. A man named James experienced mild digestive discomfort in his early 40s. He noticed he felt better when he avoided heavy meals and fatty foods. His doctor suggested antacids and said it was probably strepsilidid. James continued his lifestyle without changes. By age 50, his symptoms had worsened significantly. He experienced severe bloating, diarrhea alternating with constipation, and unexplained weight loss of 20 pounds despite eating. Imaging studies revealed chronic pancreatitis with extensive pancreatic damage. His doctor explained that the damage was permanent and he would need enzyme supplements for life. James wished someone had explained to him a decade earlier that his mild symptoms were early warning signs of progressive pancreatic dysfunction that could have been reversed with diet and lifestyle changes. The connection between dysbiosis and pancreatic health. Intestinal dysbiosis plays a crucial but underappreciated role in pancreatic disease. Your gut contains trillions of microorganisms that should exist in balance, with beneficial bacteria outnumbering harmful species. When this balance shifts, harmful organisms like Candida, yeast, and pathogenic bacteria proliferate. These organisms produce toxins that enter the bloodstream and directly damage pancreatic tissue. They also impair the sphincter of Addi, a muscular valve that controls the release of pancreatic enzymes and bile into the small intestine. When the sphincter of Addi becomes dysfunctional due to inflammation and spasm, pancreatic enzymes back up into the pancreatic duct, causing the pancreas to essentially digest itself. This is one mechanism by which pancreatitis develops. Dr. Leo Galland, a functional medicine physician who has studied dysbiosis for over 30 years, explains that Candida overgrowth and small intestinal bacterial overgrowth creates a cascade of problems that extend far beyond the gut. His research documents how these conditions cause systemic inflammation, immune dysregulation, nutrient malabsorption, and direct toxic damage to organs, including the pancreas. Candida produces acetaldehyde, a toxic compound that damages cellular membranes and impairs enzyme function. Bacterial overgrowth produces endotoxins that trigger inflammatory responses throughout the body. A woman named Linda struggled with recurrent yeast infections, chronic fatigue, brain fog, and digestive issues for years. Multiple doctors treated her symptoms individually without recognizing the underlying Candida overgrowth. She also developed unexplained glucose intolerance despite normal weight and no family history of diabetes. When she finally worked with a practitioner who understood the gut-pancreas connection, comprehensive stool testing revealed massive Candida overgrowth and small intestinal bacterial overgrowth. Treatment focused on restoring gut balance through diet, probiotics, and antifungal herbs. Within 6 months, her digestive symptoms resolved, her blood sugar normalized, and her energy returned. Her pancreas had been under assault from gut-derived toxins for years, and healing her microbiome allowed her pancreatic function to recover. The alcoholism and pancreas destruction link. Alcohol is one of the most direct pancreatic toxins. Melamed explains that chronic alcohol consumption damages the pancreas through multiple mechanisms. Alcohol increases pancreatic enzyme secretion while simultaneously causing spasm of the sphincter of Addi. This combination traps activated enzymes inside the pancreas, causing autodigestion. Alcohol also generates free radicals and acetaldehyde, both of which directly damage pancreatic cells. Chronic alcohol exposure triggers inflammation, fibrosis, and progressive destruction of pancreatic tissue. Even moderate regular alcohol consumption can impair pancreatic function over time, particularly in individuals with other risk factors like poor nutrition, smoking, or pre-existing digestive issues. Dr. David Wickham, from the University of Pittsburgh, a geneticist who has studied chronic pancreatitis extensively, discovered that alcohol interacts with genetic factors to determine who develops severe pancreatic disease. His research shows that some individuals have genetic variations that make their pancreatic cells more vulnerable to alcohol-induced damage. However, he emphasizes that regardless of genetic predisposition, alcohol is the most preventable cause of chronic pancreatitis. A man named Michael had been drinking 3 to 4 beers every evening for 20 years. He did not consider himself an alcoholic because he never got drunk and maintained his job and family responsibilities. At age 55, he experienced his first episode of acute pancreatitis with severe abdominal pain requiring hospitalization. His doctor warned him that continued drinking would lead to chronic pancreatitis and permanent pancreatic damage. Michael quit alcohol completely and adopted the nutritional recommendations from Melamed's approach. His pancreatic function tests improved, and he avoided further pancreatitis attacks. He realized that what he thought was moderate social drinking had been slowly destroying his pancreas for 2 decades. Stopping before reaching the final, irreversible stage allowed his pancreas to partially heal. Sphincter of Addi dysfunction and the bile-pancreas relationship. The sphincter of Addy is a complex muscular valve located where the pancreatic duct and bile duct join and enter the small intestine. This sphincter must open and close in perfect coordination to allow bile and pancreatic enzymes to flow into the digestive tract at the right times. When the sphincter becomes dysfunctional due to spasm, inflammation, or scarring, it creates problems in both directions. Spasm prevents proper release of bile and enzymes, causing digestive symptoms and nutrient malabsorption. Paradoxically, the same dysfunction can allow reflux of intestinal contents back into the pancreatic and bile ducts, introducing bacteria and toxins that trigger inflammation and infection. Sphincter of Addy dysfunction is closely linked to gallbladder problems, bile, sludge, and stones, and pancreatitis. Dr. Peter Cotton, a gastroenterologist who has specialized in pancreatic and biliary disorders for decades, explains that sphincter of Addy dysfunction is often misdiagnosed or overlooked because symptoms overlap with other digestive conditions. His clinical experience shows that many patients diagnosed with IBS, functional dyspepsia, or unexplained abdominal pain actually have sphincter dysfunction as the underlying cause. The condition is particularly common after gallbladder removal surgery, when the loss of the gallbladder as a bile reservoir places increased stress on the sphincter. A woman named Patricia had her gallbladder removed at age 42 due to gallstones. Her surgeon assured her she would feel better afterward. Instead, her digestive symptoms worsened. She experienced bloating, pain in the upper right abdomen, and episodes of nausea and vomiting. Her new gastroenterologist diagnosed sphincter of Addy dysfunction and explained that the surgery had altered the normal flow dynamics of bile and pancreatic enzymes. Treatment involved dietary changes to reduce fat intake, magnesium supplementation to relax smooth muscle, and herbs that support bile flow. Patricia also learned that the gallstones and subsequent sphincter problems were related to poor pancreatic function and whole body acidity. Addressing these root causes through the comprehensive approach, Melamed describes gradually improved her quality of life and prevented further deterioration. The GERD and pancreas connection nobody discusses. Gastroesophageal reflux disease has become epidemic, affecting millions who take proton pump inhibitors and antacids daily. Melamed reveals that GERD is often not a problem of too much stomach acid, but rather a symptom of poor pancreatic function and bile flow. When pancreatic enzymes and bile are insufficient, food sits in the stomach longer than it should, fermenting and creating gas pressure. This pressure forces stomach contents upward into the esophagus, causing heartburn and reflux. Ironically, long-term use of acid-blocking medications worsens the underlying problem by further impairing digestion, reducing pancreatic enzyme activation, and promoting bacterial overgrowth in the stomach and small intestine. Dr. Jonathan Wright, a physician who has practiced nutritional medicine for over 40 years, has extensively documented that most people with reflux actually have too little stomach acid, not too much. His clinical testing of thousands of patients shows that hypochlorhydria, or low stomach acid, is far more common than hyperacidity. When stomach acid is inadequate, the pyloric sphincter at the bottom of the stomach does not receive the signal to open properly, delaying gastric emptying. Simultaneously, the lower esophageal sphincter at the top of the stomach becomes lax because adequate acidity is needed to maintain its tone. The result is reflux of partially digested food. A man named Stephen had suffered from severe acid reflux for 10 years. He took prescription proton pump inhibitors daily, but still experienced symptoms. His doctor wanted to increase his medication dose. Stephen consulted with a naturopathic physician who tested his stomach acid levels and found them dangerously low. His pancreatic elastase, a marker of enzyme production, was also severely depressed. Treatment focused on supporting pancreatic function through diet and supplements, restoring beneficial gut bacteria, and gradually weaning off acid blockers while adding digestive support. Within 3 months, Stephen was off all reflux medications and symptom-free for the first time in a decade. His reflux had never been about too much acid. It had always been about poor pancreatic function and inadequate digestion, metabolic syndrome, diabetes, and the endocrine pancreas. While Part 1 of Melamed's book focuses primarily on the exocrine pancreas and digestive function, he makes clear connections to metabolic diseases. The same factors that damage the exocrine pancreas also harm the endocrine pancreas. Chronic inflammation, oxidative stress, metabolic acidosis, and dysbiosis all contribute to insulin resistance and eventual beta cell failure. Low pancreatic enzyme production leads to malabsorption of nutrients, including chromium, zinc, and B vitamins that are essential for glucose metabolism. Undigested food particles provoke immune responses and inflammation that further impair insulin signaling. The progression from digestive symptoms to metabolic syndrome to diabetes is not coincidental. It represents stages of progressive pancreatic deterioration, affecting first the exocrine function and eventually the endocrine function. Dr. Ralph Crisanzo from the University of Texas Health Science Center, a leading diabetes researcher, has documented that pancreatic beta cell dysfunction begins years before diabetes is diagnosed. His studies show that by the time fasting blood glucose rises above normal limits, patients have already lost approximately 50% of their beta cell function. He emphasizes that early intervention targeting the underlying causes of pancreatic stress could prevent or delay the onset of diabetes in millions of people. A woman named Carol noticed in her mid-40s that she felt exhausted after meals, particularly after consuming carbohydrates or sweets. She also experienced increasing digestive problems with bloating and irregular bowel movements. Her doctor checked her fasting blood sugar, which was 98 milligrams per deciliter, considered normal. 5 years later, at age 51, her fasting glucose had risen to 118, placing her in the pre-diabetic range. Her doctor prescribed metformin and told her to lose weight. Carol realized that her digestive symptoms years earlier had been warning signs of declining pancreatic function. She implemented the comprehensive approach Melamed describes, focusing on alkalizing her body, healing her gut microbiome, supporting pancreatic enzyme production, and reducing metabolic stress. Her blood sugar stabilized, her digestive symptoms resolved, and follow-up testing showed improved pancreatic function markers. She had caught her pancreatic decline in the reversible stages before permanent damage occurred. Taking action before it becomes too late. The central message of Healthy Pancreas, Healthy You Part 1 is that pancreatic dysfunction develops silently over years or decades before manifesting as diagnosed disease. The functional stage when complete reversal is possible passes unnoticed in most people because symptoms are mild and intermittent. By the time digestive problems become severe enough to prompt medical investigation, significant structural damage has often occurred. The key to pancreatic health is recognizing early warning signs and taking action during the reversible stages. Occasional bloating, changes in stool, consistency, food sensitivities that develop in adulthood, unexplained fatigue after meals, weight changes without clear cause, and increasing reliance on antacids or digestive aids are all potential indicators of declining pancreatic function that deserve attention. Melamed emphasizes that the conventional medical approach of waiting until disease is severe before intervening misses the opportunity to prevent irreversible damage. The three pandemics of digestive disorders, intestinal dysbiosis, and metabolic acidosis must be addressed simultaneously because they create a self-reinforcing cycle of destruction. Healing the pancreas requires a comprehensive approach that reduces acidity, restores beneficial gut bacteria, supports enzyme production, eliminates pancreatic toxins like alcohol, and provides the nutritional building blocks the pancreas needs to repair and regenerate. This is the foundation that Part 1 establishes, setting the stage for the detailed dietary and therapeutic protocols presented in Parts 2 and 3 of the book series. The power is in your hands. Your pancreas can heal if you catch dysfunction in the early stages. Every symptom your body produces is communication. Listen to what your digestive system is telling you. Do not accept bloating, gas, heartburn, irregular bowel movements, or food sensitivities as normal. They are warning signs of declining pancreatic function that will progress to serious disease if ignored. The structure, function, and disorders of the pancreas that Melamed explains in Part 1 provide the knowledge foundation you need to recognize problems early and take action before reaching the point of no return. Thank you for watching this summary of Healthy Pancreas, Healthy You Part 1 by Peter Melamed, Ph.D., and Felix Melamed, M.S. If this information opened your eyes to the critical importance of pancreatic health, please subscribe to our channel for more evidence-based book summaries that empower you to take control of your health. Visit our channel for the complete, detailed breakdown of all 3 parts of this revolutionary 500-page book series with 300 scientific references, including the Healing Foods Protocol in Part 2 and the comprehensive treatment approaches in Part 3. Your pancreas is sending you signals right now. Are you listening?